Good afternoon, everyone. I'm Dr. Sarah Mustafa from DentistChannel.Online. Welcome to today's webinar about laser-assisted lip reposition in dentistry, a new hope. While we are waiting for the participants to join the session, I will introduce you to our company. DentistChannel.Online is a digital dental media company. It's your marketing solution for dental events, product launches, workshops, and courses. We also provide a collection of scientific articles and blogs about different topics in dentistry. We work hard to be your first-hand information on the technological advancements in the dental field. Now it's time to start the session about laser-assisted lip reposition. If you have any question about this topic, feel free to ask it in the question and answer box, and we will answer each and every question at the end of the session. I will start by introducing today's session speakers, Dr. Norman Kusumo and Dr. Elizabeth. Dr. Norman has completed his graduation BDS from the UPDM B on July 2015 and post-graduation in periodontics from Gadjah Mada University. He is currently studying Masters in Laser at the RWTH Aachen University in Germany. Dr. Norman is also a lecturer at the UPDM B. Dr. Norman is a results-oriented periodontal enthusiast with excellent communication skills, as well as deep understanding of digital systems and innovations. About Dr. Elizabeth, she's a general dentist, graduated from the UPDM B as well. She holds also a master's degree in human resource management from the same university. Dr. Elizabeth will share a case report with us today at the end of the session. Welcome, Dr. Norman and Dr. Elizabeth. It's our pleasure to have you with us.
Hello. Thanks. Okay, let me share my screen. Okay, Doc. Yeah.
Udah. Bentar ya.
Okay, so first let me introduce myself. My name is Norman, as mentioned in the curriculum vitae by Dr. Sarah. Thank you, Dr. Sarah, for the wonderful channel online. So there is not much I say in this seminar because the time Dr. Sarah gave me only 30 minutes. So I give a more brief and compact on the seminar. Hello, Dr. Eli, how are you? Apa
I'm
kabar?
fine.
Okay.
Hello, I'm fine.
Right, okay, Doctor. Good. Okay, good. So Dr. Eli will bring a fresh and unique case before we do continue to the lip reposition case. And so be it. So in my opinion, the study club or the everything similar with this channel, the dentist channel online is really good, especially when connecting us between dentist and dentist, because as we know, the connection to get intact each other is through the education. So we can communicate with each other from country in Indonesia to Germany to Australia or some things. Everything dentists around the globe can be connected through education. Yeah. So with this channel I really enjoy this channel, and hopefully that can connect us digitally from country to country. And my name is Dr. Norman, as I mentioned before, by Dr. Sarah, and I am associate with Dr. Leonard Nelwan, and also associate with the Dr. Elizabeth. We have the same work in the clinic in Jakarta, Indonesia. And let me introduce myself. I'm from Indonesia, so maybe one of you maybe didn't know where is Indonesia is. So I just give you a very clear example of this image is in Bali. So like when I go to Germany, many people doesn't know where is Indonesia, where we come from. But when I say, do you know Bali? Yes, I know. So that is the picture. That is my country come from, and is located in the Southeast Asia. and very please welcome if you can come into our country. And also Dr. Elizabeth is from Indonesia also, yeah. Yeah. So briefly before I begin my presentation, also we have developed tools that provide from a specific dentist and purpose. So if you have some tools that maybe can benefit to other dentists, you can communicate with us so we can make it happen. Because in Indonesia, especially in my country, I have a relation with a sculptor, that engineer that can make some things about stainless steel to make it worth it to we can operate with other dentists and operation clinical. So as I mentioned before, the education is really connect us. So when you been here, you sitting here, is not wasting time at all, because it's a really infestation for us. Yeah. So RWTH Aachen University, just like I mentioned before, why I choose this university, because it was the alma mater of my previous president of Indonesia. The third president of Indonesia is the Baharudin Yusuf Habibie. So I'm really favorite with this person, highly educated person, and one of the genius person in Indonesia. So many of the young students and young scientists is fascinated with Baharudin Yusuf Habibie, and it's really privilege for me that I can continue his legacy by schooling in one of his student university in Aachen University, Germany. So tonight in this 30 minutes seminar, I will bring the most compact case about what I'm studying in Germany, but I will not bring this slide to you because I'm pretty confident that maybe for me also, when I study the first slide in this, like oh my God, this is really pure science, is pure physical about bio interaction. So I will bring you the most light and mild of the topics. So laser is a new hope for everyone, especially in dentistry. So as we can see,
I brought along my son Jonathan.
there is parents who
2001,
asked to the boy
the same
in
age as I
around
am now.
1960
He will be better
what is
adjusted to this
about
kind
the
of
computer
that you
in
want to
our
try and
future.
portray. The big difference when he
So
grows up, in fact, if we
the
want
big
to wait the year
difference.
2001, is that he will have in his own house.
So he talking about a computer that his own house connection to each other, a console. So it has been predicted for almost 30 to 40 years ago that a computer is maybe as big as this one, maybe, and have already in our own house. In 1960, computer is as big as a bus, as big as a vehicle. It's very big and only functional for the calculator, for mathematical. So, but now 40 years later, we can see computer is not in our house, but in our pocket also. It's a smartphone. Same as well as a laser. Maybe in 20 years ago, laser is really not affordable. It's always written, laser is future in dentistry. But now, laser is in dentistry because it's really affordable. So now we can have a device laser that can cost you less than 5,000 euro to 10,000 euro. And also there is another laser that can cost you 200 euro. It's all depend on the marketing on your clinic. So why laser? Because in my opinion, laser has many benefits and many biophysical interaction radiation that cannot be touched by non-instrumental or conventional dental instrument. So just like I mentioned before, I always do a chapter 1, and chapter 2 will be bring first with Dr. Ellie, yeah, after I finish this basic theory. So laser is a light amplification by a stimulation emission of radiation. So it's a high spectral energy and power density and monochromatic with selectivity. So in Indonesia, we call it sinar, and amplified is mean dikuatkan or we stronger this light, and we put it in a media that contain a reflector in each part, in the right side and in the left side. And then this light will be more give power by a power stimulate, and this media will reflect to the left and right this light, yeah, will travel to the left and right, we continue increasing the power, and then we open a small hole between the media on the left and right, so the laser light will come through. The light amplified and stimulated emission will be come through from the hole. So that is what we call a laser. So it's a radiation, but it's not an ionizing radiation. So we must clear that it's not ionizing that harm our DNA, that not harm our mutation or soft tissue, especially when we go from ionizing radiation. When we talking about ionizing radiation, is about uranium-253 or the isotope uranium that being potentially by the uranium that can cause the ionizing radiation, maybe in Chernobyl or something. But in laser dentistry, it's not a radiation that I mentioned before. So it's a cohesive, focused, and efficient. So as we can see, if we put some smart light here, yeah, if we go through the camera and the light is going more focus, yeah, going more deeper and smaller and focus. But if we going for far more distant with this area, the more area is more get wider. Yeah, for very example is my face. If I put it more closely to my cheek, the laser is like a pointer. Yeah, it's smaller. But if we go farther the distance between the laser, the effect will be wider. So it's a physical biointeraction of laser. So the more closer you get to the laser to the soft tissue, the more ability to have penetration depth in the soft tissue. The more power, of course, the more penetration depth. The more power and the more far distance is also have a same and different effect. So that's why we need to understanding what is the physical and bio interaction. So as we can see here, you know, the laser wavelength can really travel here. See, and this is from the surface to air. Yeah, so it can the laser, so laser can reach through the cloud here for more than 400 meters above the ground. From the airplane, the laser can still penetrate through the cabin in the cockpit pilot. So how far laser can go is as far as this. So how much we can maintain and contain this laser so can be useful to dentist, to patient, but we consider the safety. Now, that's why you need to also have understanding the LSO or the laser safety officer to understanding the physical and bio interaction of laser.
To make a laser, all you need to do is give a big emitting light forever. But why do the atoms emit light just because another photon passes by? It's actually pretty simple.
It's very simple theory, yeah. It's a head of
they
theory.
can tell one apart from another.
They are
so
going to left and right.
That means there's only phase
like
polarization
this one,
atom that could
you can see.
Once you have all these friendly photons bouncing around.
See, bouncing around to the left and right, left and right, left and right, left and right, and then we just open a connecting pathway to this. And this is a laser. See? So it's very simple way, you know. Like
so
this
once
one,
you have all these friendly photons
median to
bouncing
left,
around
right, and left, right.
You can just open up a little hole.
Just open up a little hole and pathway, and then voila, you have a laser device. So why is Dr. Norman you always mentioning the same physical interaction? Because in my opinion, right now, laser is really easy and adaptable to all of the soft tissue and all of the treatment. And also you have already programming the laser. So when you want to choose frenectomy, you just choose frenectomy. Gingivectomy, you just choose gingivectomy on your manufacturer in the laser. But the main important things, what I learned in RWTH Germany is we need to know the manually and the physical biointeraction foundation on the laser. So if you know the physical biointeraction foundation on the laser, you can choose many manufacturer laser and you can really easy adaptable on one. Just like we driving a car with a manual transmission. And if we already master the manual transmission, and then if you want to go to the automatic transmission, it's really easy to go there because you already master the basic. Just like I said, you already master the basic. So what is why laser, we call it radiation, because it's distance of our laser radiation, and it's really enjoyable. So this is a graphic, As you can see, there is a diodin, neodymium yak, and erbium, and also C and isomer or CU2 laser. So a diodin laser is a laser that can well absorb in the melanin and the hemoglobin. And also we see there's many benefits in here. So maybe Dr. Ellie will soon see the case that her case about the laser. So the laser is depend on the time and the power and the distance. And I will give you brief more further about that. And when we talking about laser, there is laser like surgical and therapeutic. So when we choose for surgical, we choose for like cutting, and we choose like for a surgical. When we choose for a therapeutic, it's mean we choose for a low level laser therapy. So after we know a little bit about laser, and also I will choose you about, we bring you the next topic about a lip reposition. And a lip reposition is a quite bit treatment that's still quite not familiar in our dentist, because it's also still not every person can do a lip reposition. The lip reposition, although it's a very basic of the lip reposition. So lip reposition is basically a treatment to treat a gummy smile correction. So you can choose a Botox, botulinum injection, but in dentistry field is our field is mandatory to use this lip reposition. Yeah. So when we talking about lip reposition is when we talking about gingival display. So 4 to 8 millimeter display, and also when we talking about lip reposition, there is higher chance and risk to having a bleeding. Yeah, you know, because we talking about manipulate muscle around the mouth. So having a chance to getting bleeding and infection and something is really high in lip reposition. So the chapter 2 is I'm talking about two main function of laser that can provide sterile and can provide one of the most fierce dentists is having a bleeding on her patient during the treatment. So please stay focused in our seminar, because right now after this Dr. Ellie will share a screen about what this laser can do, especially when we talking about hemostatic effect. You know, laser have a hemostatic effect that can, when we cut, is really less bleeding. So after Dr. Ellie, and will be continued by me presenting the case of lip reposition. Dr. Ellie, do you have already ready for the presentation?
Okay, I'm ready, doctor.
Okay, yeah. So Dr. Sarah, if with your permission, I will ask Dr. Ellie to, he is a content creator in YouTube. You can visit her as well. And he's also a smile designer and a dentist in Gadjah. Yeah.
Okay. Hello, everyone.
Yes.
Good night. Let me introduce myself. My name is Dr. Elizabeth. I'm from Indonesia. Actually, I am Dr. Norman is my colleague and the owner of our clinic, my boss. Today, I would like to share a case I handled. So, okay, this is the picture number 1. This picture show that a 65-year-old woman who had a loose dental crown, and she has diabetic. And then from the intraoral examination, I found that an endodontic treatment had been done for her first and the second premolar of the right mandible, and this tooth had a gingival enlargement, particularly in the buccal and interdental. In addition, there were 2 dental crown units came loose. Okay, in the first picture, And then next on the second picture, from this case, I decided to perform a gingivectomy on the first and second premolar to clear the working area so I can make resegmentation procedure easily. As the patient has diabetic, I took the laser gingivectomy procedure, like this picture. Next. And then, okay, this is the photo was taken shortly after performing a gingivectomy using a laser. So we could see the condition of the teeth. The bleeding occurring was also very, very minimal, or even almost no bleeding here. So with the minimal bleeding, it took us more accessible to do the next stage. Okay. So let's we compare the picture on the left and the picture on the right. Here we can see the difference very clear. The picture on the left show a tiny leftover root, and then the picture on the right show the condition of the whole teeth. It is evident that laser therapy was very, very beneficial in addition to minimize bleeding, so the working area becomes clear. And then laser in dentistry will also shorten our working time. So what is the laser doing here? So in this case, the laser can cause vasoconstriction in the blood vessels to minimize bleeding. In this method is very safe for this diabetic patient, especially because the tissue can heal immediately. So this picture is when the laser procedure is done by performing. As we can see, the root canal already clean and ready to be resegmented. Okay, so this is the dental crown that will be resegmented. Okay, in this picture we can see that the crown is resegmented. There is still blood, but very, very minimal, and the patient also does not feel the pain. So this is a photo a week after the laser treatment without antibiotic. We could see that very rapid tissue regeneration here, and then the gums recover very well, and the crown can survive very well. So after 6 months, there were no symptoms from this patient. So the conclusion is that laser in dentistry provide many benefits, ranging from speeding up our working time, reducing the pain, minimizing bleeding, and speeding healing. Okay, that's all from me. Hopefully, this sharing can add more info, especially about the benefit of laser in dentistry. Thank you.
Yeah. Okay. So with your permission, there, right, Dr. Sarah, Dr. Eli will also perform his own seminar as a presenter. In matter of time, we just see in her tiny schedule, and we hopefully that maybe she can bring more case to us, and we bring more seminar as a first speaker, yeah, in this channel. So thank you. Very brief case report that had actually been done in Get Dentist. So without further ado, I will do the chance and the case in laser in lip reposition. So this patient came to me with a 4mm of gingival display, feeling any discomfort at all, and what we can do is also, as a periodontist, we see the mucobuccal fold area and we see the attached gingiva area is well or is indicated or is not. If we indicated, so it's mean it's go. It's a green go button to do a lip reposition. And the first thing that I noticed is the patient is really feel uncomfort or feel any what we can say, yeah, maybe feel dysphoria about having to meet a dentist, very scared to meet a dentist. So, but you want to change her smile. So what should we do? Especially when we always see a patient that may be very scared to a dentist. If she already very scared to face me, how about if she already see a lot of blood when doing operation? When we accidentally see a blood when they're doing operation, or maybe it's a nightmare to her. So I think there is another way to give her a chance, to give her a second opinion of treatment, exclude the conventional treatment, that is by laser. So I give her a digital smile design projection in up and down, before and after to her, and she is agree, and we do the laser lip reposition. And as we can see, and as mentioned before by Dr. Elizabeth, laser have a physical bio interaction that can minimize the bleeding by reducing the arterial bloods. So the vasoconstrictor and the blood vein, it can make it smaller and can hold the hemostasis effect on the soft tissue, so the bleeding is really lessful, and the patient is feel really comfort when doing the operation. And as you can see, we do hapting is I do to 10 to 12 hapting in this area, on the left radian area and the right, and also in the center. And one of the most important thing when we do a laser lip reposition is we can have a double function and double benefit. Oh, why is that, doctor? So after we finish the treatment, we do a therapeutic laser, as I mentioned before, is a laser that can regenerate the healing process. So we do a surgical process with a laser, and we do a faster wound regeneration with the RLT, or the low level laser therapy, with this device that I show you in this seminar. So like this one. So this is like after the operation. I do the low level laser therapy. What is that for, doctor? Is for the sterilization. You know, even our dental instrument is still contain any bacteria. So doing this laser therapy will make sure the enhancing the regeneration process of this therapy. So this is, as you can see, for I do faster recall of the patient. This is a 5-day recall of the patient. As we can see, the soft tissue is already in regeneration, but as far as I'm concerned, is a much more faster regeneration in a conventional therapy, because you got a benefit. You got the surgical with sterile with laser, and you got to promote and faster the healing regeneration with the low level laser therapy. And also the laser therapy, I do it in the second visit. Yeah, so in the baseline and the first visit, I do a laser therapy as well. So as we can see, it's not a 2 weeks. Everyone maybe mentioned, it's 14 days. It's not a 2 weeks. It's a 10-day of control. So it's 4 days more faster than the regeneration of my usual lip reposition. Usual my lip reposition, I do a 2 weeks control, and the result is like this. But in laser, 2 days, and the result 10 days, the result is already like this. So the conclusion we doing with laser is more precise and more sterile compared with the other conventional treatment, and less blood, as mentioned by Dr. Elizabeth before, and we do accelerate the regeneration process. So that is a physical interaction of radiation, laser biophysical, that maybe none of the conventional laser therapy is not. So after you having a laser is also important when you have a LSO, or a laser safety officer, because we need to understanding even a laser can penetrate through a droplet. Yeah, so when we doing a laser, it's really safety, using a safety around the sunglasses. So as you can see, another recorded of incident involved a university assistant suing, is according to the law. showing a 39 million after she sustained a laser eye injury in laboratory because the professor is failed and didn't notice the assistant is through using laser safety in this area, because the professor is still focusing, I'm already focusing on this area. The assistant is far from 3 meter to 2 meter far distance, so it will not harm her eye. But the professor didn't notice that laser can also be reflected of a droplet. So it's the radiation we must safety, so we need to understanding the laser bio interaction and safety. Yeah. So we must pay attention also with a fiber coupler and very safety. Yeah, beware of the specular and a reflective surface on the instrument and the tools, and also doing eye protection. And this is like the merge area or hemorrhaging caused by 3 millijoules of an infrared laser, and they have failure to use a protective on eyewear. So you must different between an aiming beam and a laser. And the first, when we turn on, is an aiming beam. It's okay when we see with an eye, is a red color. And usually when we do some laser operation, is a near infrared color. So usually we didn't notice the color of the light. So how do you select the right laser? It all depends on your market. And enjoying the benefit of the laser dentistry as have a wow effect and less invasive and less painful with better healing. I think that's it all for now. And thank you again, Dr. Sarah, for having us in a small brief of this Dentistry channel. And me as the part of the Get Dentist Dental Clinic, we also thank you, and my associate also, Dr. Elizabeth, who willingness her time in her tight schedule to still have opportunity to share her case to us. So let us hope that this all benefit. And hatur nuhun, it's mean thank you or terima kasih in our country. So we will do open for the Q&A discussion. So Dr. Sarah, the session will give it back to you. Thank you.
Thank you so much, Dr. Norman and Dr. Elizabeth, for this interesting webinar. So meanwhile, I will ask your permission to introduce our company to all the participants. And I request all the participants to kindly put their questions in the question and answer box if they have any. So this is our organization, DentistChannel.Online, Healthy Smiles, Wealthy Lives. I request all the participants to kindly save this number and then send a message on WhatsApp with their name, so they will be added to our broadcast list and they will receive everything about our upcoming dental webinars and courses. Today's session is sponsored by NovaMind. NovaMind is a company and it offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implant types called internal hex, tissue level, bone level, and active conical connection. Our EU production unit and product quality is appreciated worldwide. Dental implants and dental restorative solutions produced maintaining all the standards of EU medical device regulatory. Products are manufactured in Athens, Greece, and distributed worldwide with more than 1 million happy restorations. If you want more info, kindly check their website. And those are the offers by NovaMind. About our upcoming dental webinars, Tomorrow we have a webinar with Dr. Karam Korea about treatment options for a missing tooth at 10 p.m. Indian Standard Time. This Sunday, we have another session with Dr. Mahmoud Atiyah from Egypt. He will talk about the concept of minimal invasive in full mouth rehabilitation. On November 27, we have a session with Advocate Sushant Samudrala at 11:30 a.m. He will talk about legal aspects of dental practice, part 1. You can find part 2, you can find part 1 on our YouTube channel or our Facebook page, DentistChannel.Online. About our upcoming dental workshops, we have an online workshop about short dental implants on 30 and 31st of October, so tomorrow and after tomorrow, from 9 a.m. until 12 p.m. Indian Standard Time with Dr. Himang Zala. Last but not least, I would like to invite you to join our second World Implant Expo 2021, starting 5 November via virtual platform with more than 30 speakers, 30 CPD points, and live interactive sessions. For more info, kindly check worldimplant.expo.com. If you have any question, kindly call or WhatsApp this number or visit our website events.dentistchannel.online. If you're not a Prime member yet, kindly join our family to get free certificate of participation after every event and benefit from exclusive discounts and offers on online dental courses, on-site dental courses, and much, much more. Last but not least, don't forget to follow us on our social media platforms, Facebook, Instagram, YouTube, and Twitter. So now we can move on to the question and answer session. So Dr. Stevie is asking, is there any contraindications for laser usage in dentistry?
Okay, so contraindication when we talking about laser dentistry, this all depends on the treatment of the patient. So one of the most important thing of contraindication when we dealing with soft tissue is when we dealing with a very thin thickness of the soft tissue. When we want to do some gingivectomy or we want to do a curettage with a laser and we notice there is some exostosis in this area inbound, the soft tissue, the gingiva is really thick, or no, it's really thin. It's really thin, perhaps maybe the thin's about maybe 0.7 millimeter or 1 millimeter is contraindication because we need to really be careful not to expose the bone when we do a laser therapy. And in other hand, laser is safe. So I think it's not much more of the contraindication of laser. Thank you.
Dr. Rasha Ibrahim is asking, can a complete protocol for laser lip reposition be given? Can you give one later on?
Yes, of course. I will give later on of the laser of lip reposition, but of course, it cannot be done with a single session because there is many protocol, but like as mentioned before, the simplified of this protocol is we do a cutting in a surgical procedure and we do a therapeutic area like a low-level laser therapy for enhancing and regeneration process. So a complete protocol is still look like a same lip reposition as well, but the laser therapy and the program is different. There is a cutting and therapeutic. The rest is still the same like a conventional lip reposition.
Thank you, doctor. I think that's it. We don't have any other question. I'd like to thank you, Dr. Norman Kusumo and Dr. Elizabeth, for sharing your knowledge and experience with us.
Thank you.
We are looking forward to organizing more webinars with you. Thank you so much for everything. It was a very interesting session, especially very nice cases.
Okay. Yeah. Thank you. And
much.
so be it. This is the end of the seminar, and I will ask permission to leave the meeting. Hope you all us find well and have a great health, and wish you again in another chance of the meeting in another day. Thank you. Good
Hopefully
night.
in future. Thank you so much.
Yeah.
Bye,
Thank you so
everyone.
much,
Bye.
Thank you,
Bye-bye, Dr.
Bye.
Eli. Ketemu
Bye,
lagi
bye.
di klinik.
everyone. Thank you so much.
Ya,
Thank you. Bye-bye.